I'm Robert Willing. I shall be your student nurse today. Would you please state your name and your date of birth for me? Thank you, Mr. Jones. Now I shall close the curtain for privacy. Mr. Jones, letting you know the procedure we're going to be doing is I'm going to be doing a dressing change for you, okay? Now, on a scale of 0 to 10, with 0 being no pain and 10 being the most pain that you've ever experienced in your life, what is it? A 1? Okay, that is great. If my patient had any more pain, then I would apply medication. I would give the patient medication and then come back in 30 to 60 minutes, reassess the patient, and then proceed with the procedure. The patient is okay, so now I shall verbalize hand hygiene and washing my hands. My hands are clean, and now I shall gather my supplies. I have my red bag, my sterile field, my saline solution, and my measuring device with gloves, and I have my sterile gloves over here, which I'll apply later. I'm going to place my red bag here for the procedure, as well as the measuring device, and keep all this. I shall drape the patient, keeping as much privacy as possible, as well as now I shall apply my gloves, a pair of clean gloves, because I am just removing the dressing. Now, I have already adjusted the bed's height, and I do not have to lower the side rail at all. So everything is at waist level and everything. Now I shall remove the dressing. And I shall discard of this. Now, if this dressing, if I was going to debride it, then I would pour a solution. I would not pour a solution, but since I am not debriding it, I would pour a solution and help to get rid of the wound itself. So without contaminating or breaking sterility, I shall get rid of that and discard of it. Now I shall remove my gloves and do hand hygiene again. I shall wash my hands. Okay, now I'm going to prepare my sterile field. Prepare my sterile field. Sorry, I did this wrong. I would go away from me, the sides, and then towards me. Now, I would drape this underneath the patient, yes. So that way, if there was any spilling or anything like that, it would be okay. Now, I shall take some saline, and I shall pour, this is a new bottle, so I do not have to worry about lipping it, but for demonstration purposes, I shall lip it anyways. So, with the label facing me, I lipped it. So now, I shall pour a little bit in there, recap it. Okay, now I'm going to clean Now I am going to, no, I need my sterile gloves. Sorry, I apologize. Before anything, I need to do my sterile gloves. So, I shall open up my sterile gloves. Making sure to not touch them at all. Now I'm going to do my dominant hand first. Take it. Grab it, because I am able to grab the bottom. Okay, and then I would take it here, cuff it underneath. There we go, and I'm going to have my sterile gloves. So, now, I shall take gauze, and I shall clean the wound from least contaminated to most contaminated, which would be without breaking sterility, cleaning inside the wound, throw it away, get another one because you have to have a separate gauze for each stroke. The outside, get another one, and clean that outside. Now, I would notice if there was any drainage or the amount, the color, the odor. There is none, so we are good here. Now I shall measure using a Q-tip measuring. You measure length first. Length, you would go from the tip all the way down, and then I would measure, and then I shall measure the width. Next, I shall measure the depth without touching the wound. And then now I shall assess for tunneling if there is any, which I do not see any tunneling, so we are good. If I did, then I would measure and go to the edges and see how long it would be. Okay, now I shall be getting ready to actually redress the wound. So, I'm going to take some gauze, because there was one gauze in there, so that means all I need is one gauze. Bring out excess. Now I shall take a Q-tip to help me apply this. Start. Packing the wound, being very sterile as possible without touching the sides or anything. Getting that. Okay, there we go. Now for the procedure, I shall take 2 gauzes, dry gauzes, place one over, place another over, and then I'll take the ABD pad and place it on top as well, line there, and now I shall dispose of my sterile gloves, which are now soiled, so they are not sterile anymore at all. Ironic, isn't it? Go underneath, dispose of them, and verbalize hand hygiene once again. Now, I shall apply my tape securely. And then my last one has my name, date, time, and initials on it, and I shall place that one right there in the middle. And then now, since that is done, I shall reapply gloves to clean up the area. Just clean gloves because I'm just cleaning up. I shall remove this pad, dispose of that. I shall recover the patient for privacy. I shall now dispose of that. This, because it is sterile, it will be okay. I shall dispose. Okay, now that I have cleaned up my area, I shall get rid of these gloves. Verbalize hand hygiene again, and then I would document. For documentation, I would address how the patient took the procedure. I would assess the amount, the color, and the odor of the wound. Then I would express the wound closure, as well as if there was any drainage that had to be done, the cleansing or irrigating, which we did not have to do, as well as I think I already said patient tolerance, but I will say it again anyways. So, but the patient took it well. Now I will adjust the patient for how they are, place a call light within reach, and then I shall let the patient be.